Well, what I had done was I had all of my front teeth changed completely. I had the crowns and a bridging done as well. I think I had 8 crowns, I think, and 1 bridging. I hope I'm right in that, but there's a massive difference in the front compared to what they were. It was something I was thinking about, would you believe it, for 10 years, and I kept on putting other things in my life in front of doing them, and I was starting to get a bit embarrassed about them, and they were getting a bit yellow, and I was kind of neglecting them as well. My own hygiene practice for doing my teeth and all that wasn't good, and then I had gingivitis as well, so I would bleed a bit here and there, and then you get to the stage where you kind of get so used to the bleeding, and then I kind of said, you know what, I need to do something about this, because I said it wouldn't be getting any better. So it was a choice that I had to make, to put myself first, and that was a challenge to even do that. Yes, yeah. I'm just after coming back from my holidays. My son works in the cruise ships, and he brought us out there now, and myself and my daughter went out for Christmas, and I was able to smile away at the captain and the people, and it was a good feeling actually, that I wasn't kind of shying back a bit when it came to the photographs and that did make a difference actually.
Yeah.
Absolutely, it was, and I suppose one of the things for here really would be, I was absolutely terrified coming in, even though I had been to the dental practice before over the years as well, and but this was a big procedure for me, and I was very worried that the teeth would be too white, and I always referred to the doggy dentures, but I was just worried that they'd be too modern for my age group, which I'd be in my 60s, so it was extremely important, I think, that we had the conversation about that they'd be as natural to my own skin and that as it is, and that was worrying me coming in, I have to admit it was.
Yeah.
No, not an ounce of pain, and I must compliment, I found Dr. Bowe, Robert Bowe, very, very professional, very much at ease into any questions that I had as well, and there was a lovely sense of humour as well, which I think is extremely important, because I did come in a bit anxious, even though I'd be smiling away myself and talking away at the back of it. I was nervous before I came in, and nervous when I was coming in the door, and there was all that, and there was lovely nurses, dental nurses as well, and it made an awful difference actually. I think the atmosphere was a big thing for me actually, that it was even coming into a reception and meeting yourselves in the first point of contact as well. It did make an awful difference, because when the people around you are at ease, it put me at ease then as well. Whereas if I thought it was too clinical, I probably could have walked at the door and said, you know what, I won't bother with this.
Yeah.
But and it was very efficient as well, and that to me was very important. I found it very good. What I couldn't get over actually was my own reaction actually when I had the teeth done, and then they presented me with the mirror to look at my teeth compared to what they were, and I absolutely got totally overwhelmed to the point of tears in my eyes that I couldn't get over for myself. I think it was just that I had been talking about it for so long. I also felt, where was I going at 60 years of age? A lot of emotions went through my head actually. One of the biggest ones was, why didn't I do it 10 or 15 years ago? And I just got very overwhelmed, and I didn't really look in the mirror actually when they gave me the mirror. I kind of side looked at it, and then they went out and left me for a few minutes with it, and I still didn't look at it. I was very, very overwhelmed. But after a while then I settled, and I had a good look when I went home, you know, but I just felt I was very overcome by the fact that I had actually got to do it, even financially as well, and I have to bring that part up as well, because I kept putting other things before myself. So I did the right thing, and I heard a lady both in the practice here and someone from the outside as well, and they were saying the word investment, and yes, that's what it is. And I'm very happy now that I took the time, because I would have gone into 2020, I would have found something else that would have come in front of myself again. And so now they're done. And one of the things as well which was important is that they were done efficiently and quickly and timely as well. It wasn't coming in over several months, getting a bit here and a bit there. So that I found brilliant. So when I made up my mind, the job was done professionally and timely as well, which was a big thing for me. The important thing was, I think, was part of my own health journey, and I mean that sincerely when I say this, is that my own health I look after to a reasonable extent, but I would never think of, God, I need to do my teeth, do you know? So I think it has given me great encouragement and confidence, because I have another little bit to do, and I'm also even discussing already about doing some more work in my lower teeth as well, you know, which is something that I will consider, maybe not straight away, but I certainly hope not to lose sight of that and to keep going. So I think the confidence that it has given me has encouraged me to keep going.